Hi, I'm Olivia from Public Health, and today we're talking about routine vaccines that we often get as kids. We'll talk about how vaccines work, what to expect, and what questions to ask, plus some tips for making the experience as easy as possible for you and also your kids. Our community health nurse, Brandy Likes, from our clinic team, is going to answer some questions we hear about childhood vaccines and share what parents should know.
We know vaccines are safe. They've been studied before humans are ever introduced to them. They're studied with 3 different trials. The FDA regulates these vaccines, and we also study and do research on them after they've been in our communities and in our populations. So they're very safe. Children are very vulnerable. Their immune systems are coming into their own. They're more vulnerable to certain conditions, and a mother to a child does pass on some passive, what we call passive immunity. For a certain period of time, those children have that protection from their mother. As children get older, we add on to their schedules. We give them different vaccines at different times because this information that's been studied and researched is that's the best timing to protect them with what they're going to start encountering when they start attending school or preschools and as they grow. All our vaccines, we can almost always guarantee there's going to be some discomfort at the injection site, but it's very limited. Most vaccines that we get as adults or children, we don't have a big side effect, and anything that's considered outside of the realm, we would want you to report to your doctor, healthcare provider, and those are what we would put into a VAERS report so they could be monitored. But very, very rarely do we have any adverse reactions. Most commonly, side effects are just some discomfort at the injection site. With immunizations, it's scary. So being positive, trying to let kids know it's safe, the parent or guardian, who's ever bringing them in, wouldn't want them to have any bad outcome. So it's okay to give rewards if in your family, if it works for your family. If you want to talk to the nurse before coming in, what's appropriate for your family, what's not. If they can have a little straw, if they can pick out their Band-Aids, colors, just something that's somewhat distracting, still positive, so the children feel safe and get used to trusting the environment, and then it's less anxiety every time they come. Unfortunately, there's a lot of vaccine fatigue and a mistrust in our vaccines. What I would do is recommend having an open dialogue with your pediatrician, what your concerns are in relation to the benefit versus the risk of your child receiving a vaccine. You can always call us at Public Health. We as a whole want our communities to be safe and healthy and protected, and our role is education. So if you have questions, please call us. If you have concerns about your child's immunization or schedule, we can go over that with you. We just want you to be informed and know that there are very simple schedules with immunizations to prevent disease and complications.
Thanks, Brandy. If you have more questions about vaccines, it's a good idea to talk to your pediatrician. You can also ask our public health clinic staff at your vaccine appointment. Learn more at slowpublichealth.org/vaccines or give us a call at 805-781-5500. Take care, SLO County. We'll see you next time.